Have you ever passed out and wondered just what the heck happened? Well, stick around because in this video, your favorite cardiology nurse practitioner is going to break it down for you. But first, hello everyone, my name is Ray and I'm a hospital-based nurse practitioner who specializes in cardiovascular disease. If you're new to the channel, welcome. If you're not new, welcome back. In this channel, we like to talk about heart disease, both prevention and treatment, other topics related to the heart and overall health and wellness. So if that sounds good to you, let's get started. When someone passes out, we call that syncope. According to the American College of Cardiology, syncope is an abrupt, transient, complete loss of consciousness with loss of postural tone, meaning your posture is like this, with rapid and spontaneous recovery. The underlying mechanism is presumed to be cerebral hypoperfusion or lack of blood flow to the brain. When someone has a syncopal episode, it must be distinguished from other causes of loss of consciousness, such as seizures, head trauma, or psychogenic pseudosyncope. In the hospital, a lot of times cardiology is consulted. That's where yours truly comes in, as well as my neurology colleagues. Neurology is consulted to ensure that this wasn't something like a seizure or something like that. Seizures typically are distinguished by a family member mentioning that they witnessed the patient having like some jerking movements during the event, as well as either losing bowel or urinary continence, meaning they peed or they pooed themselves. So sometimes you might have a cardiologist and a neurologist seeing you if you come into the hospital after passing out. So according to the American College of Cardiology, some of the key features that define true syncope include abrupt onset, complete loss of consciousness, loss of postural tone, and finally spontaneous recovery without intervention. Syncope is broadly classified into three major categories: cardiac syncope, reflex or neurally mediated syncope, or orthostatic syncope. Cardiac syncope can be a result from an arrhythmia, either bradycardia or tachycardia, meaning heart's beating too fast or too slow. It can be a result of structural heart disease or conditions causing decreased cardiac output, such as valvular obstruction or acute vascular dissection. Reflex syncope is the most common type and occurs due to a reflex causing vasodilation, which means your blood vessels open up or dilate, which in turn drops your blood pressure, causes bradycardia or low heart rate, or both of them. Vasovagal is the most frequent subtype, and it's typically triggered by an emotional stress. You've probably heard of people passing out when they received news like, the passing of a loved one, for example. But vasovagal syncope can be caused by pain, prolonged standing, things like that, and it's characterized by prodromal symptoms like diaphoresis or sweating, warmth, nausea, and pallor. Other subtypes include carotid sinus syndrome and situational syncope, which is triggered by coughing, micturition or peeing, or defecation. In my practice, we get this one a lot. People getting up in the middle of the night and going to the bathroom either pass out on the way to the toilet or on their way back from the toilet. Incidentally, there's a very common medication called tamsulosin or Flomax that's usually older guys are on, sometimes women as well, but usually guys are on it because they have an enlarged prostate and it helps them urinate. This medication has a well-known side effect of syncope. Now, please understand, I'm not telling you to stop your tamsulosin. Please talk to your urologist or PCP before you stop any medications. Other things that can cause reflex syncope include prolonged sitting or standing, pain, like we just talked about, the sight of blood. I've had many patients over the years tell me this, that they aren't able to look at blood draws, because they pass out. Actually, my son just recently had some blood drawn, and though he's had multiple blood draws in the past, typically he's a trooper, and watches, and he does pretty well. He nearly passed out the last time he went. He got pale, sweaty, and said it felt like he was losing his vision. So he was definitely on the brink of passing out, but thanks to the quick thinking and action of the experienced phlebotomist, she was able to bring him back from it. Reflex syncope can also be caused by a distended stomach or bladder. Some possible autonomic symptoms include headache, sweating, nausea and vomiting, abdominal pain, skin pallor, and sense of cold or warmth. When someone goes to the hospital for syncope, the emergency department team, which includes an ER physician or advanced practice provider such as a nurse practitioner or physician assistant, will obtain a detailed history and physical exam. The detailed history should ask about any prodromal symptoms like we talked about a little bit ago, like nausea, sweating, warm sensation. This detailed history should also include questions about any prior syncopal episodes or any family history of sudden unexplained death, as this can mean an inherited cardiac condition. Actually, ironically, I had a patient the other day. She told me that she had never passed out, but her mom did, and she's had complete cardiac workups, and they were pretty benign, meaning there was never any cardiac reason that could explain her syncope. The physical exam will be looking for clues such as injuries sustained that help support the diagnosis of true syncope versus exclude it. For example, if someone falls back and cracks the back of their head, it's likely that they had a true complete loss of consciousness versus if they fell forward and they were able to catch their fall. That might mean they rather experienced some leg weakness or maybe had a near syncope instead. The ER team should also obtain an ECG or electrocardiogram and orthostatic vital signs, which means they check it in different positions when you're lying down flat, in a laying down flat, in a sitting position, and then standing up. The orthostatic vital signs should be obtained on immediate standing and after 3 minutes of upright posture. Cardiac exam should assess for any heart murmurs or gallops, while the neurologic exam should identify any focal deficits. By the way, a focal deficit would be someone like having unilateral paralysis, which would rather favor a stroke, and then that'll warrant what we call a stroke rule out. And then the ER team will likely call a teleneurologist to make sure that you're not having an acute stroke, because that's a whole different workup. Again, if this is the case, you might have both a cardiologist and neurologist coming to see you. From a cardiology standpoint, in addition to the above, we would want to have you monitored overnight on cardiac telemetry, which is a monitor that you wear overnight. And then when I come in the morning, I'll check to see if there's any evidence of arrhythmias, either too fast or too slow heartbeats, etc. I'll also order a complete echocardiogram if it hasn't been done yet, or if you haven't had one done within the past year, or if you had one done and it was like stone cold normal, we might just get a limited version of it. Echocardiograms give us a lot of information, though it can't tell us directly if you have any blocked arteries. It can indirectly lead us to consider or recommend what we call an ischemic evaluation to check for blocked arteries. There are basically three main types of ischemic evaluations, which all have their strengths and weaknesses. A CCTA, or coronary CAT scan, which is basically a CT scan that directly focuses on the arteries of the heart. There's a stress test, which has both false positives and false negatives. And by the way, there's treadmill stress tests and pharmacologic stress tests, so we won't always have to walk you on the treadmill. And then there's the gold standard to check for blockages, which is a heart cath. Now, a heart cath is the best way to check for blockages in the arteries of the heart, but it also has the highest risk too. So we don't always recommend doing a heart cath unless it's clinically warranted. I'll talk more about a heart cath in another video, but going back to the echo, an echocardiogram is very helpful for us as it can tell us what the pumping function of the heart is, or what we call the ejection fraction, or EF, as well as how well the valves are opening and closing. This is what a murmur is. A murmur is the sound that is heard when someone listens to your heart and they hear a murmur. What they're hearing is the backward flow of blood across one of the four heart valves. There are different kinds of murmurs and even severities, and that's a topic for another video as well. But going back to the echo, if the echo is normal, we'll likely discharge you the following day from the hospital and have you follow up with us in the outpatient setting. We'll likely also recommend a Holter monitor, which is a home monitor that you wear for a few days, maybe even a couple weeks sometimes, depending on what we find. We may refer you to a cardiologist who specializes in electrophysiology. In cardiology, we like to say we have plumbers and electricians. Sometimes you need both, but a lot of times you might just need the electrician. By the way, electrophysiologists are the ones that put in pacemakers and defibrillators if you need one, so they're the ones that can do it for you. They're like a one-stop shop. You'll likely get some blood work done as something such as a complete blood count, which checks your hemoglobin levels and tell us if you're anemic, which if you have severe anemia, this could be the cause, like a very low blood pressure, and certainly can contribute to passing out due to decreased blood flow to the brain. You'll also get a comprehensive metabolic panel, which tells us about your electrolytes and your kidney function, as sometimes something as simple as dehydration can be the cause of you passing out or almost passing out. You'll also likely get a test called a D-dimer, which is a test that it's going to be elevated if you have something called a pulmonary embolism. That can certainly cause you to pass out as well. So if the D-dimer is elevated, you might get another test called the CTA of the chest to rule out that pulmonary embolism if your kidney function is normal. If not, you might get something called a VQ scan to check for pulmonary embolism. The ER team will also order cardiac enzymes, including a troponin and BNP levels, to check to see if there's any evidence of injury to the heart. Syncope accounts for 1.7 million emergency department visits per year in the United States. A lot of times we'll educate patients on lifestyle interventions such as ensuring adequate hydration, because dehydration is actually quite common, and most people do not drink fluids adequately and rather drink coffee, which is a diuretic. And we'll also educate patients on using electrolytes after strenuous exercise, as well as using compression stockings sometimes if we think that their syncope was due to something called orthostatic hypotension. So if you've made it this far, I want to thank you for spending your time with me today. Time is one of our most precious gifts we can give, and it is finite, so thank you for sharing yours with me today. If you have any questions about this or any other video, feel free to leave me a comment. I read and answer them all, and I look forward to an engaging community. If you found this video to be helpful or informative, please let YouTube know by subscribing to the channel, and make sure you turn on your notifications so you'll never miss when I upload a new video. I want to say a big, huge thanks to all of the current subscribers, all 387 of you. Y'all are really motivating me to continue to do this work and make content that helps others. Please consider sharing this with the people you love in your life. Together, I think we can decrease the burden of heart disease one video at a time. While you're here, please consider checking out some of my other videos about what Big Pharma doesn't want you to know about diabetes. I have a video about hormone replacement therapy and how it impacts heart disease. I have a video about GLP-1s like Ozempic and Wegovy. I have a video about how to count calories and how to get started with fasting, so go check those out too. I'll see you in the next video. God bless you.